Week 3 Assignment Crohn's disease presentation. Objectives for this presentation include overview of Crohn's disease, anatomy and physiology, comprehensive review, Crohn's disease treatment strategies review, meeting of Crohn's disease patient family educational needs. Overview of Crohn's disease. Crohn's disease is a chronic GI tract autoimmune inflammatory bowel disease that causes fibrosis, ulceration, and malabsorption. The most common reason for the death of Crohn's disease patients is their main condition, followed by thromboembolic disease and malignancy. Pediatric patients usually manifest with disease localized in the small intestine. This deteriorating and incurable condition is chronic, with periods of remissions and exacerbations. Overview of Crohn's disease epidemiology. 5 to 15% of the mouth or gastroduodenal area involvement. The yearly frequency of Crohn's disease in North America is described as 3.1 to 20.2 for every 100,000 people, with predominance of 1 for each 100,000 person in population. And you can see the picture that this shows different sections and the involvement for each section in the percentages. Overview of Crohn's disease pathology. Patchy transmural inflammation are its important characteristics, as you can see on one of the pictures. The chronic inflammatory process causes bowel wall thickening and may lead to a constricted lumen. In the initial Crohn's disease stage, there is a presence of prominent lymphoid follicles and subsequent apoptoid ulcerations that progress into deep fissuring ulcers that are bordered by mucosa that is normal in appearance, strictures, fibrosis, and fistula formation. Genetic vulnerabilities, environmental influences, host immune response, and the final result is the Crohn's disease. This is the diagram for Crohn's disease pathogenesis. So that's how it works in this picture, in this slide. Crohn's disease symptoms. Frequent complaints for Crohn's disease patients include diarrhea, which is chronic or nocturnal, abdominal pain is in the right lower quadrant, which is similar to appendicitis, generalized malaise and fatigue, usually linked to pain, anemia, and inflammation. Other symptoms include initially there is constipation, there is perineal disease, weight decrease, abdominal mass, cramping during bowel movements. There may be presence of rectal blood and mouth lesions. And here you can see the table that compares Crohn's symptoms to those of ulcerative colitis. For the imaging, colonoscopy, terminal ileoscopy provide direct visualization and used for a mucosa biopsy, and is important for macroscopic and microscopic diagnosis. Mucosa usually seen with cobblestone appearance in these cases for colonoscopy. Double contrast barium enema examinations can attain findings consistent with Crohn's disease, and it shows asymmetrical changes in mucosal structure, with lumen narrowing and stricturing and deep ulcerations. Continuing Crohn's disease diagnosing, physical exam outcome could be normal or show general signs of Crohn's disease. More explicit findings show sinus tracts, perineal skin tags, palpable abdominal mass, or abdominal tenderness, usually in the right lower quadrant. Usual laboratory tests could be normal or confirm anemia, white blood cell count increase, electrolyte irregularities, and increased C-reactive protein, iron insufficiency, B12 and vitamin D insufficiency. Stool inflammatory indicators could be fecal calprotectin or lactoferrin, and could be increased because of intestinal inflammation. A differential diagnosis could be related to Crohn's disease, and it is wide-ranging and differs with the affected site and the chronicity of the clinical manifestation. Infectious colitis can be caused by various infectious pathogens such as Yersinia, Clostridium difficile infection, cytomegalovirus infection. Signs and symptoms could mimic those of Crohn's disease. Blood-body diarrhea could be seen in colonic Crohn's disease or could be caused by ulcerative or infective colitis medications, antibiotics and NSAIDs, and colorectal cancer. Acute ileitis secondary to Yersinia infection for patients whose small bowel is affected is also a possibility. Crohn's disease treatment options include a medical regimen for Crohn's disease consisting of dealing with acute exacerbations and remission maintenance. Folic acid, mineral vitamin supplements are important for healing and reduction of possible complications, including anemia and bone disease. Opioids deliver diarrhea, symptomatic relief. During acute periods, aminosalicylates are the golden standard mainstay treatment for Crohn's disease therapy because of their fast absorption and anti-inflammatory actions throughout the small intestines. The 5 ESA drugs have not been FDA approved for Crohn's disease use. Balzalazide and sulfasalazine are mainly released and absorbed in the colon. Pediatrics use from 50 to 75 milligrams per kilogram is administered in 3 to 4 divided doses and up to 1 gram per dose. Here is a table taken from the book by Cash and ETO, and it shows some of the medications that are used for as a stepwise treatment option for Crohn's disease. Crohn's disease treatment options that include surgical management. Patients should be hospitalized for cachexia fulminate disease, vomiting, fever, and indication of abscess or obstruction. Surgery does not cure the patient and is used to deal with obstruction, perforation, intractable disease, or profuse bleeding. The goal of surgery is to eradicate grossly involved bowel and to preserve maximum of normal functioning bowel capacity. Post-operative relapse rates are observed within 30 to 50% for every 10 years and are inversely related to preoperative disease length. So, finally, the education includes the patient needs to consume fewer foods that can worsen their symptoms. Some patients have issues with foods with high fiber content, including fruits and vegetables. It is important to stop smoking because it may worsen the symptoms and increases the probability that there is going to be a need for the surgery. It is important not to use medications such as Motrin and naproxen that may worsen the symptoms. And there are many different medications that help to deal with symptoms or to prevent their reoccurrence, and most of them achieve it by decreasing inflammation and the body's immune response. Okay, this is the end of the presentation. Thank you.